So first, let's start with you just introducing yourself, telling me a little bit about your educational background, your current position, and the years you've been practicing.
Okay, my name is H.Peterson. I am been practicing as an athletic trainer since 1980, licensed or certified since 1983, licensed since 2008 in the state of Washington. I received my AA from Citrus Community College, my BA from San Diego State University. I completed coursework for a master's in athletic training from San Diego State University. Did not write a thesis. I completed coursework for a master's in athletic administration from Gonzaga University. Didn't finish my thesis. I have taken over another 25 to 30 units of graduate coursework at California University of Pennsylvania and Eastern Washington University. I am currently working as an athletic trainer 25 hours a week at a high school and 15 hours a week in an outpatient orthopedic clinic.
Okay, so first question, this is all about evidence-based practice, since it's a fairly new concept in athletic training anyways. So to you, what is evidence-based practice?
Evidence-based practice isn't new to me. During my undergraduate and graduate experience at San Diego State, I worked in a program directed by a gentleman named Bob Moore. And Bob was a proponent of evidence-based medicine and doing research studies. And so we used current research in our practice, and it was an emphasis of our educational curriculum to use current evidence-based practice. For me specifically, what evidence-based practice is looking at how current research and findings integrates into what I have already been using in my practice, based on both patient preference, what the patients like. That's a small portion, but what works with patients, and also combining my clinical experience with what evidence-based practice is, and having a very open mind to new research, but also understanding how difficult it is with human beings to define anything that relates to human well-being.
Okay. So in your athletic training room right now, how do you think you utilize evidence-based practice on, say, a daily basis?
I use evidence-based practice in everything I do. In my rehabilitation techniques, I took a selected functional movement assessment course, and I use those movement screen techniques. My evaluations have evolved over the years based on what research has shown to be actually effective assessment tests and what have been shown to be not evidence-based assessment techniques. I constantly search the literature. I subscribe to a number of different science-based email accounts that provide me with research. I try to read a journal article at least one a week, which doesn't sound like much, but I'm constantly, I receive, like I said, email updates from about 5 different providers of evidence-based medicine. So I'm constantly trying to tweak. I attend continuing education courses, trying to find the evidence to support some of the newer techniques, for example, kinesiotape and myofascial techniques. So, okay. Yeah, I like to think I combine the best of what my past experience is with the best of what is current we use today.
Okay. So why do you think this movement for evidence-based practice is so important for the athletic training profession?
I think it's important for all medical professions. There's a lot of dogma. It's hard to stay current. It's very easy to do what you were taught, so to speak, to not have a questioning mind, and you're so busy taking care of people, and if something was effective for you, you may be inclined to continue doing that, even though there may be a more effective technique. or there may be some negatives with the technique. I go back to 35 years ago when we casted me post-op and pre-op for 6 weeks. We pretty much did a 180-degree turn to mobilization and putting them in CPMs, and that was an overnight change. So I'm well aware of how you can never just assume what you've done in the past is what is in the best interest. And people change. The population I treat nowadays have grown up with a completely different nutritional background, different stressors, different emotional stressors, different environmental effects on their physiology. So what worked before may not work anymore because the human body is different.
Right. Okay. So you seem to have a pretty firm grasp and support for it. In your experience, do other athletic trainers have the same understanding and acceptance for evidence-based practice?
I think there's a misunderstanding of what evidence-based practice is. Some people think it's applying the latest and greatest research, and that's only a part of it. It's taking what research is finding out and using what your past experience is and making a clinical judgment on what is in the best interest of that specific patient based on all of those things, your clinical practice, what the patient will and won't do, and what current evidence supports. So I think there's a misunderstanding that evidence-based practice means if there's a research article that says do this, then you have to do that. And that's not what it is. You have to be able to interpret the research data itself and see if it applies to the population or the individual that you're working with. So I think that there's a misunderstanding with that. Again, it's weird for me because I was the practice that I worked in initially as a community college athletic training student was very dogmatic and old school. We still got people better. I within a year, went into a very modern, evidence-based, research-oriented training room at San Diego State. And so I saw the two different worlds. So before it was called evidence-based medicine, I was practicing evidence-based medicine. So I really have a hard time understanding how you couldn't do that, but I've worked with athletic trainers that don't.
Right.
So I think there's just a misconception on it's hard to stay current.
Mm-hmm.
And it's a misunderstanding that you can't combine what you already know with what moving forward.
Okay. And just a question, because I know you interact and work with a lot of college entry-level students, athletic training students. Do you think that this will change their preparedness, good or bad, in the future for working?
I think that there are some negatives, again, because of the misunderstanding. It seems to me, in my limited experience in working with the very few 20 or so college athletic trainers in the last 5 years, that their conception is that anything new is good and anything from the old is out of date and not useful. And that's not the case. They oftentimes don't have the ability to scrutinize the research and to understand that that research was based on a certain population and don't have the perspective that comes from balancing current research with knowing how much things have changed in my career.